I'm Dr. Mohammad Ilias. I'm here to present today's topic about the physical medicine. Okay, I'm going to share the screen. Okay, can you see the screen clearly, Kamrul?
Yes, sir, clearly.
Okay, thank you. Okay, let's go. Is it clear, Kamrul, right now?
Yes, sir.
Okay, thank you. So I am introducing myself first. Actually, I am Dr. Mohammad Ilias. I'm the Associate Professor of Physical Medicine in BBMH USTC, Chittagong. Today I will discuss the topic on the physical medicine, and that is a very basic topic for the undergraduate level students. And that's why actually I told here about the physical medicine introduction in the term of the comprehensive introduction to physical medicine and rehab. You see, I mentioned over here the comprehensive, so that we can have some idea about the pros and cons of the physical medicine. So that's why I told over here the comprehensive introduction to physical medicine. So if you think of the physical medicine, actually, we can't think the physical medicine without the thinking of the rehabilitation. So that's why the total name of the physical medicine is the physical medicine and rehabilitation. So now I'm going to show the next slides over here. You see, so what is physical medicine? Actually, the broad name of the physical medicine is physical medicine and rehabilitation. Without thinking the rehabilitation, actually, we can't think of the physical medicine. Actually, if you think of the physical medicine, actually, you must have to think of the rehabilitation. Without thinking the rehabilitation, actually, we can't proceed anymore with the physical medicine. So that's why the total name of the subject is the physical medicine and rehabilitation. You see, I mentioned over here, it comprises two aspects of these two things, that is the physical medicine and rehabilitation. So before knowing all the things about these things, actually, we must have to know what is physical medicine and what is rehabilitation. Actually, seemingly, actually, if you think of the physical medicine, actually, those who are very greenhorn about this subject and those who are the undergraduate level, actually, you must have to know about the physical medicine. Okay, I am discussing these things. You see, that is the subspecialty from the faculty of medicine. If you think of the subspecialties of the medicine, there are lots of subspecialties of medicine. You know, these days, actually, the medicine has been subdivided into several subspecialties, like the pulmonology, like the hepatology, like the gastroenterology, like the neurology, like the nephrology, like the lots of things. So likewise, actually, physical medicine is another entity of the subspecialties of medicine. Okay, so, and if you think of the definition of the physical medicine, actually, first of all, if we can tell like this, actually, definitely that will deal with the treatment and the diagnosis of the musculoskeletal diseases. So you see, first of all, I mentioned over here the musculoskeletal diseases. With the physiatrist, actually, or the physical medicine specialist, actually, will go for the treatment and the diagnosis of the musculoskeletal diseases first. And this is the very prime thing of the physical medicine. And we go for the treatment and the diagnosis of these diseases by the physical items and the exercises, massages, and assistive devices. You know the assistive devices, there are lots of assistive devices for the rehabilitation procedure, for the treatment of the disabled person, those who are having the musculoskeletal problems, like the elbow crutches, like the crutches or the auxiliary crutches, or like if you think of the wheelchairs. So all these things are the assistive devices. And sometimes we also go for the intervention. Actually, that could be the blind intervention, that could be the image guided intervention. If you think of the image guided intervention, actually, we go for the fluoroscopy, we go for the ultrasound intervention. So these are all the interventions. So with the physiatrist, actually, we'll go for the treatment of this kind of musculoskeletal diseases by exercises, by massages, by assistive devices, and intervention sometimes in conjunction with the drugs. Mind it, as a physician, we must have to go for the treatment first. Whenever a patient is coming to us with the pain, with neurological problems, with any kind of problems of the body that could be associated with the musculoskeletal disorders, so that time we must have to prescribe the drugs as a physician. And along with these drugs, actually, we must have to take this kind of support. And that is the uniqueness of the physical medicine. If you think of the other subspecialties of the medicine, in all other subspecialties of the medicine, actually, they definitely go for the medicine treatment, they go for the intervention. But here, we the physiatrist in the physical medicine arena. Actually, we treat the case with the drugs, definitely. We go for the intervention as well. And we also take the support from the assistive devices. We go for taking the support from the physiotherapist, from the occupational therapists, and we also utilize some kind of physical attempts and the exercises and massages. In this case, actually, chiropractor practices are also very much helpful for treating the cases. So this is the actually very nutshell definition of the physical medicine. So with the physiatrist, actually, we try to treat this case by utilizing these kinds of things along with the drugs. So I think by hearing this, by listening to this definition, actually, you could have some idea about the physical medicine. Okay. So along with the definition, actually, we must have to know by how many names actually it can be coined, it can be termed. That is the physical medicine. Actually, if you think of the physical medicine, actually there are also some kind of synonyms of the physical medicine in some other parts of the world. In Bangladesh, that is very popularly known as the physical medicine rehabilitation, and sometimes we also use the physiatry. Okay, and in the US, actually, this physical medicine is termed as the physiatry. If you go to the European countries, actually this physical medicine is also termed as the rehab medicine, or also sometimes it is also called as the orthopedic medicine. If you think of the orthopedic medicine, actually that is the counterpart of the medicinal counterpart of the orthopedic surgery. If you think of the, actually, if you want to understand the correlation between the orthopedic surgery and the orthopedic medicine, actually we should focus on the cardiac surgery and the cardiac medicine. So by hearing about the cardiac surgery and the cardiac medicine, actually you can have some idea about the treatment scopes of the cardiac surgery and the cardiac medicine, or the cardiology. The cardiology actually treats the case of the cardiac problems with the medicinal intervention or the intervention. But if you think of the cardiac surgery, actually definitely they will go for the bypass surgery, they will go for the surgical intervention. So likewise, if you want to find out the correlation between the orthopedic medicine and the orthopedic surgery, actually the correlation could be actually resulted like this. Can be solved out like this. So I think you could have some idea about the correlation between the orthopedic medicine and the orthopedic surgery. So in our country, actually, both the terms, that is the physiatry and the physical medicine, are very well known. And we actually prefer the physiatry term because if you think of the specialist identity in the physical medicine arena, actually we must have to have the identity of the physiatrist. Okay, so those who are expert in the physical medicine and rehabilitation, they are the physiatrist. Mind it. Okay, I'm going to the next slide. And what's about the rehabilitation? If you think of the rehabilitation, actually, in a nutshell definition, actually, we want to define this like to make an unfit person fit again. Those who are having the unfitness, actually, they must have to undergo some process of rehabilitation procedures. Without having the rehabilitation procedures, this kind of unfitness can't be overcome. So that's why actually the unfitness must be overcome by utilizing the resource personnel in the rehabilitation procedure, and the rehab protocol must be there to make those unfit person fit again. So that is the nutshell definition of the rehabilitation. There are some other complex definition in the book. If you think of the bookish definition, actually there are big bookish definitions. And right now I am going to tell about this bookish definition. But if you think of the nutshell definition of the rehabilitation, that is the nutshell definition, that is to make the unfit person fit again. That means those who are having the unfitness due to the impairment, due to the handicapness, or due to the disability, these are the unfit persons. So to make those unfit persons fit again, actually the rehabilitation procedure must be there, and the rehab protocol must be established by the physiatrist with the support of the physiotherapist and the occupational therapist. And this actually protocol must be there. Without having this kind of protocol, actually the patient can't undergo the total process of rehabilitation. So to make the unfit person fit again is called the rehabilitation, mind it. So now I am telling one bookish definition that is a very complex definition, and that because the rehabilitation process is also a very complex one, I think in the community medicine you actually went through this kind of definition about the rehabilitation. That is, I am just reading it out actually. you need not actually get all these things by hearted. Just for your easy remembrance and for your more understanding, I'm just telling this by reading it out. A complex process of integrated application of many procedures to achieve restoration of an individual at home and in the community to his or her optimal potential by utilizing all of his or her residual assets. Let's say a patient is having the impairment. Due to the impairment, the patient actually is not having any kind of anatomical actually existence, like a patient lost his hand. So that is actually the anatomical impairment. Or any person is having the stroke. Actually, for the stroke, actually the patient actually is having the hemiparesis. For the hemiparesis, the patient will be having some kind of partial weakness or almost complete weakness. So yeah, by utilizing this kind of partial muscle power, actually the physiotherapist actually try to make those unfit person, that is the impaired person, to maintain his optimal potential activities by utilizing his residual assets. So that is the process that is very complex one, and that should be the graded one, and that should be the customized one, actually up to which level the patient can utilize these kind of things, and that's why the customization must be there. So it is not unique for all the people, and that is not stable for all the people. Actually, it can vary from people to people. So that's why that is the customized process of the rehabilitation procedures. So that is very important things. Okay. So now actually I want to discuss some terms in relation to the rehabilitation. Just before I told you about the person, those who are having the unfitness, actually those who are having the unfitness, the patient must be having this kind of three things, that is the impairment, disability, and handicapness. Actually, all these things actually will come to the patient due to the disease process or any kind of disorder within the body. And whenever these are not well treated, and whenever these are not actually well rehabilitated after having this kind of disorder or the disease conditions. Okay, I will show some of the slides about this, actually what is disability, impairment, and the handicapness. Now I'm just trying to tell some of the things about the impairment. Actually, what is impairment? Actually, actual anatomical, physiological, and psychological deficit of the body is called the impairment. Say a patient is having the lost hand due to the road traffic accident. So that time the patient will be having the anatomical impairment. So that time the patient will be anatomically impaired. So now what is physiological impairment? Say a patient is having the stroke. So due to the stroke, the patient actually developed the ischemic stroke, ischemia in the brain, or the infarction in the brain. So due to the infarction or the ischemia, actually the patient is having the problem in the brain. So that is the anatomical impairment. Okay. And due to the anatomical impairment, actually the patient is not able to move his one-sided upper limb and the lower limb. So what happens over here? The upper limb and lower limb actually lose their muscle power to go for the activities. So that time, though the anatomy is there, but physiologically the patient is having the impairment. So that is the physiological impairment. And if you think of the psychological impairment, the patient, if you think of the psychiatric patient, the patient's anatomy and the physiology is okay, but the physiology is distorted. So that time the patient will be having the psychological impairment. So I think by having this kind of actually discussion, I think you could have some idea about the impairment. Okay. So now what's about the disability? Whatever the patient is having the problem to implement his activities before having the impairment. Say a patient actually usually had to have the ability to write with the right hand. Due to the stroke, the patient right now is not able to write with the right hand due to the stroke because he's having the right-sided hemiparesis. So that time he's not able to write with the right hand. So due to the stroke, due to the anatomical and physiological impairment, the patient is now not able to write with the right hand. So that time for the writing activity, the patient is now disabled. But if in course of time, the patient can can learn how to write with the left hand, so that time he will be no more disabled for the writing activities, though he's having the impairment for the right-sided upper limb and the lower limb. So if you think of the disability, it can sometimes be overcome by relearning process, by maintaining the rehabilitation procedure for the patient. So that kind of disability can sometimes overcome even after having the complete persistence of the impairment. So I think you could have some idea about the disability. So what is impairment? Actually, anatomical, physiological, and psychological deficit of the body is called the impairment. And whatever the patient can do due to the impairment, like the normal person or before having the impairment, that is called the disability. In Bengali, we call the disability as the অক্ষমতা। আমরা যেটা করতে পারছি না, that is the disability. And what is impairment? That is the deficit. আমাদের কোনো কিছু না থাকার, that is the impairment. Okay. And what's about the handicapness? Before actually thinking about the handicapness, you must have to know the scope of the disability. Actually, what happens in case of the disability? In case of the disability, actually, the problem happens in the surrounding area of the patient. Say the patient can't do his right-handed activities due to the stroke in the surrounding vicinity. So that is the disability. And the disability will be counted at home or in the vicinity of the patient. But if you think of the handicapness, in Bengali, we call it as protibondhita. For the handicapness, actually, the patient can do his activities in the social perspective areas. If you think of the official activities, if you think of the distant schooling activities for the students, so sometimes actually what happens, we can't take the patient, we can't take the person to his optimum potential level due to the disability or impairment in his social areas. So that time the patient will be handicapped. So if you think of the heel tracks, I'm just trying to quote some examples for you in front of you. That is, if you think of the heel tracks, there are some areas where the students have to go for long distance schooling activities, where they have to go for climbing up the hill. Sometimes they have to go down the hill only on feet. So that time they can't have any kind of support from the vehicles. So if a person, if a student loses his leg due to any kind of accident, so in that case, actually, due to the lost leg, actually, by utilizing the crutches, he can maintain his household activities at best. But if you think of the distant schooling activities, actually, he can't go for the distant schooling activities where the vehicle won't be available anymore for the support of the transport. So that time the patient, the student will be handicapped. I think it is clear to you. That is, for the distant schooling activities, the patient will be totally handicapped. That is, there will be some kind of protibondhita. Patient কিছু প্রতিবন্ধিতার জন্য the patient can maintain his social activities. So that is the handicappedness. So the core thinking of the unfitness is the impairment. The secondary thinking is the disability, and the tertiary thinking is the handicappedness. So impairment will be within the body, disability will be within the vicinity of the patient, and the handicappedness will be within the surrounding areas of the social activities. So that time the handicappedness will be there. So disability means the অক্ষমতা, handicappedness means the protibondhita. So I think I should go to the next slide. So you see there are some flowchart of the international classification system of the impairment, disability, and handicappedness. You see how the impairment, handicappedness, and disabilities are there. Actually, all this happen due to the inappropriate treatment and inappropriate inappropriate rehabilitation of the disease condition or the disorder. Say a patient is having the stroke, we are not actually taking the patient to undergo to the total complex rehabilitation procedure. So that time the patient will be having the impairment, the patient will be having the disability and the handicappedness. So to overcome this kind of handicap and disability and impairment, early intervention of the disease treatment with the rehabilitation must be essential. So in this case, actually, whatever the disease condition is there, if any kind of musculoskeletal problem, if any kind of neurological problem, or if any kind of actually respiratory or the cardiac problem is there for the patient, so that time the physiatrist will be the prime mover for actually intervening for this kind of rehabilitation procedures. So the role of the physiatrist is not any more less than other physicians. And I think this is not my thing, actually, that is the established thinking of all the areas of the world. Actually, the physiatrist actually must have the involvement in treating the neurological problems, in treating the cardiac problem, in treating the respiratory problems, in treating the musculoskeletal problems. Actually, the physiatrist will be the prime mover for this kind of activities. Okay, I'm going to the next slide. So you see here, I mentioned actually some of the disease condition and what could be the deficit, what could be the disability and the handicapness for the patient. Okay. Okay, I'm showing over here. You see, if sorry, if a child is having the cerebral palsy, so what will be the deficit within the child? You see, the inability to move the leg, inability to bear the weight on the feet, inability to move the hands properly. So that time the patient will be having this kind of deficit. So that is the disease, disease is the cerebral palsy. For the disease condition, the patient is having this kind of deficit, that is the impairment, that is the inability to move the limb. So what will be the ultimate consequence for the disability? The patient won't be able to walk here and there, won't be able to use the keyboard, won't be able to use his household activities. Even he can't maintain his ideal activities. I will tell something about the ideals later on for you. So these are the disabilities for the patient. Within his own vicinity, he can maintain his activities. So that is the disability. And what's about the handicapness? If you think of the social activities, the patient, the child can't maintain his social activities due to the cerebral palsy, that is the disease process, the deficit and the disability. So that is the handicapness. I think you got the point. Okay. Just before I told you some of the examples about this. And now, what's about the dyslexia? I think you know about the Tare Zamin Par. Tare Zamin Par is there. Actually, one student had the dyslexia. So that student actually was not able to read all the things very properly. So they used to read out all the things in disorganized form. And after seeing the dyslexic patient, actually you can have some idea. And if you watch that movie very well, actually I think you are not, you will be very much oriented about the dyslexia. So what happens over here? Inability to associate sound with the symbols. That means actually the student can't actually utter the sound of the alphabet very properly after seeing the alphabetic symbol. So what happens over here? As a consequence, the patient will be having some disability to read out anything. Okay, and the learning process will be totally interrupted. The patient actually can't read out anything very clearly, and his learning strategy will be totally changed. So these are very important actually examples for you about the deficit, disability, and handicapness. Okay, I am going to the next slide. So the same thing that I just discussed earlier, that if you think of the cataract, the patient will be having the disability. He can't read out anything with his own clear vision. And so as a consequence, he can't actually maintain his distant reading for the schooling activities. So he will be having some exclusion from the school. So that time he will be having the handicapness. Okay, I'm not going to discuss this since I think after having the learning about the examples of the handicap and disability and impairment, I think that will be clear for you. Okay, so you see that is the very basic thing about the core point of the organ disability. That is, if the organ is having the disease, so that time the organ will be associated with some kind of impairment, and the secondary problem will be having the disability. You see, I think you can see the movement of the cursor. You see the organ is having the impairment, and as an impairment, actually the patient will be having the resultant problem. That is, the disability will be there. The patient can't do his own individual activities, and as a consequence, he can't even maintain his social activities. That is, in the society, he won't be able to do his activities. That is the pratibandhita. So that's why I told you earlier about these things. That is the basic thing. The primary thing is the impairment. The secondary thing is the disability, and the tertiary thing is the which will be associated with the society activities will be associated with the handicapness. Oh, you see there I actually showed some of the pictures. Patient having the impairment. Patient actually utilizing some of the assistive devices to overcome the disability. You see here, I think you can see the movement of the cursor. The patient actually having some kind of impairment due to the lost leg, And to overcome the lost leg activities problems, the patient using the crutches to overcome the impairment, to overcome the disability. Without having the support from the crutch, without having the support from the assistive person, actually the patient can't move from here to there. So that time the patient is utilizing this crutch. Or sometimes if the person is having the total paraparesis or the paraplegia, the patient must have to use the wheelchair. Or sometimes the patient must have to use the axillary crutch. So all these things actually must be there to overcome the disability handicapness, and this will be in the form of the assistive devices. And by this, the person can overcome the disability sometimes, and sometimes the patient can overcome the handicapness if the proper support can be given by the society. Okay, I will show some of the pictures for you in the developed country, actually how they can support the handicapped people, how they can support the disabled people to overcome the disability and handicapness in the social perspective areas to maintain their own activity, own their jobs. You see the lady is utilizing the wheelchair, and she's also using the laptop. Another lady, old lady, she is using the that is the walker, and another one is the joystick guided automated wheelchair. And you see another lady, she is blind, and she's using taking the support from the pet dog, and that is also another process of rehabilitation. And the lady can do her activities very well. And you see another lady, she is playing the tennis with the support of the wheelchair. And you see another lady, she's another man, he is not having the both amputated legs are there, and by utilizing the processes of the lower limb, and he can go for the running activities. So these are all the things actually which can inspire the disabled or the handicapped person, and he won't be any more disabled or handicapped if the proper support can be given to the disabled or handicapped person by the society. And these are actually in the perspective of the developed countries, and this system is not well developed in our country till now. Okay, so you see this lady is she's doing all the activities, she's utilizing the ramp to go for the up climbing activities, and she's also going for taking the snap, that is the selfie, and she's moving from here to there, and she's very happy, and she's utilizing the wheelchair. Okay, so these are you see that is a tram, and everything is well organized for the disabled person, and the disabled person can get into the tram with the support of the ramp over here. Okay, and these are very well developed, very well set in the developed country. If you go to the Mongolian countries like China or the Korea or even Thailand, you can get this kind of support. But here, unfortunately, in our country, it is not well established till now. Okay, though still we have to try, we have to strive till now. Okay, so you see the person is doing all the thing. The person, those who are having the disability and handicap, they are moving from here to there by the support of the other personals. Okay, you see that kid, he is also utilizing the desktop with the support of the foot. So he is not disabled, mind it, though he is having the impairment, that is the lost hand is there, but with the support of the foot and by utilizing the support of the mouse, the kid can do all the activities of the desktop. So though he is having the impairment for the both lost hands, but still the kid is not disabled or the handicapped person anymore. So that is the rewarding thing for the kid. So now, who are the physiatrists, or who is the physical medicine specialist? Earlier, I told you about the physical medicine. Alternative name of the physical medicine is physical medicine and rehabilitation, and another name of the physical medicine is the physiatrist. So those who are expert in the physiatry are called the physiatrist, and he must be a medical graduate with postgraduate qualification in physical medicine and rehabilitation. In Bangladesh, that is a very happy news for you. There are 3 degrees, that is the MCPS, FCPS, and MD. So if you want to establish your career as a physiatrist, you can come to this world, and that is very happy subject, and that is very rewarding subject for the patient and the doctor as well. And he must be a doctor, mind it. If you think of the pain, especially if you think of the physiatrist, actually you must be a doctor. Okay, without having the MBBS degree, you can't be a physiatrist. Okay, mind it. And actually, what are the treated condition by the physiatrist? Actually, you must have to know. A physiatrist treats a wide variety of medical conditions that will affect the brain. If you think of the brain injury or the brain hemorrhage or the infarction is there, actually the physiatrist, actually in the secondary stage of the brain injury, the physiatrist must come forward to make the injured patient totally rehabilitated. And the physiatrist will be the prime mover for the total rehabilitation procedures. And if you think of the spinal cord injury, initially this will be treated by the spinal cord physician, that is the spinal surgeons or the neurosurgeons, but ultimately this will be handed over to the physiatrist. Otherwise, actually, the patient cannot undergo total rehabilitation procedures. So the prime moving activities of the rehabilitation procedures must be supported by the physiatrist, mind it. If you think of the neuronal problems, that is the nerve injuries or any kind of problems, say if you think of the antapeneuropathy, that happens in case of the Saturday night palsy, if it is associated with the neuropathy, or if you think of the carpal tunnel syndrome, if there is any kind of double cut syndrome, if you think of the sciatica, or if you think of the double cut syndrome in the lumbar region, so that time the physiatrist will come forward to support the patient. Okay, and if you think of the bones and the joints injuries, say in the form of the ACL injury, if you think of the osteoarthritis of the joint, so that time the physiatrist will be so much supportive for this kind of problem, because actually though we are treating the case with the support of the drugs, but still we do have some other options to heal the problems within the joint with the support of the polotherapy, with the support of the PRP, platelet-rich plasma. We can also go for the stem cell therapy. We can go for the nutraceuticals. So all these things actually can be possible with the physical medicine support. So that's why those who are not having the exposure of physical medicine, actually they can't know the beauty of the physical medicine. And that is the uniqueness of the physical medicine. I think those who came to our physical medicine department, I think those who had been sincere in our department, actually they could have some idea about the beauty of the physical medicine. I will tell about my students, and they had been very much sincere in my USTC, and I think they could have some idea about physical medicine. And now, if you think of the ligament or muscle injury, it happens in case of the sports injuries, those who are having the tennis elbow, those who are having ligament injury, so that the physiatrist will come forward to treat the case in the form of the intervention, in the form of the physiotherapy or the occupational therapy. All this kind of support can be provided by the physiatrist. Even in case of the orthopedic rehabilitation, the physiatrist will come forward to treat the case very well. Okay, so I'm going to the next slide. Okay, I'm taking some time to drink some sips of water because I'm having some kind of dryness. Sorry for the interruption. So another things actually you must have to know about the physiatrist. Actually, the patients of all ages can be treated by the physiatrist. If you think of the young aged, very young chaps of the young early age of 2 years, 3 years, those who are having the cerebral palsy, these patients can also be treated by the physiatrist. If you think of the very old people, geriatric people, they also will have the support from the physiatrist. So no kind of actually age barrier will be there for the physiatrist for treating the case. And the physiatrist will focus on the treatment on the function, mind it. The patient, those who are having the lost function, to regain the lost function, the physiatrist will support the patient very well. That is the uniqueness of the physiatrist. If you think of the other disciplines, actually they will only treat the patient for actually recovering from the disease condition. But if there is any kind of secondary side effects for the disability or handicapness or the impairment for the lost function, so that time the physiatrist will come forward. And that's why he can give lots of support for the patient. Okay. And the patient actually will have some kind of injury, will have some kind of illness or the disabling condition for any kind of primary diseases, and that will also be treated very well by the physiatrist. Okay, I'm going to the next slide. And definitely the patient actually must be treated by the physiatrist with the support of some other paramedical personnel. If you think of the physiotherapist, if you think of the occupational therapist, if you think of the speech therapist, actually they will come to give us support. Without taking their support, actually we can't move that much easily. So these are the paramedical personnel. They are not the doctors, mind it. They are the paramedical personnel. They will come forward and they will actually be led by the physiatrist, and the physiatrist will be the team leader. And in this actually rehabilitation procedure, actually there could be some support from some kind of primary care physicians, neurologist and orthopedic surgeon, or sometimes we might take some kind of support from the neurosurgeons to go for the total rehabilitation procedure for the patient. So here in this team, the physiatrist will be the prime mover, that is the leader. Okay. So he will decide what to do, and he will take the opinion from the physicians, and he will give the order to the physiotherapist, occupational therapist, orthotist to make a plan to actually organize the procedure to make the unfit person fit again. So that is very important thing. And a physiatrist actually will treat the case of the disability or the handicapness with the holistic approach. Mind it, just to overcome some kind of problem, actually after this, the patient will be left by the physiatrist. No, not like this. To make his total rehabilitation procedures, to make that unfit person fit again, that is the prime duty of a physiatrist. So that's why the holistic approach treatment is very important for the patient, those who are having the disability or handicapness. And what kind of treatment modalities can be provided by the physiatrist? First of all, definitely earlier I told you about the drug treatment that can be provided by other like other physicians, and that is the first treatment. And there will be the secondary and the tertiary treatment for the patient, and that will be graded treatment. Okay, and sometimes we use some of the medical appliances to go for the treatment, to go for the diagnosis by our own activities like the EMG or NCP. Okay, by actually EMG and NCP, actually we may go for the intervention for reducing down the spasticity, for localizing the enterpineuropathy. All these things actually can be actually provided for the treatment procedure, and this kind of support from the medical appliances must be taken by the physiatrist. And sometimes we also use the ultrasound guided procedure, that is the sonographic intervention. We also utilize this kind of sonographic intervention, that is the visual sonographic visualization is actually will be so much helpful for the determining the localized area of the problem of the disease condition, and that treatment will be so much precise if we can look for the ultrasound guided intervention. Or another thing is the fluoroscopy guided intervention. Actually, for the fluoroscopy guided intervention, actually we take the support for the fluoroscopy for the intervention of the facet joint arthropathy, or if you think of the epidural injection, if you think of any kind of nerve block, we can take the support from the ultrasound for the and the fluoroscopy machine as well, and the injection of the spine. And for the injection of the spine, okay, we may also go for the ultrasound guidance or the fluoroscopy guidance. And sometimes we also go for the discography and the disc decompression and the vertebroplasty or the kyphoplasty. This can also be done by the physiatrist in the developed countries. Here in our Bangladesh, we are not practicing this much these days. Okay, and the physiatrist and another things, actually we may also use the neuronal stimulator, and sometimes we may go for the blocks or the neuroablation block. So this kind of procedure can be done for the peripheral or the spinal neuropathies. And sometimes we may go for the injection of the joints, that is the intra-articular injection. We may use the nutraceuticals, we may use the steroid for the inflammatory arthropathy. We can use the prolotherapy in the form of the oxygen along with the dextrose in the form of the prolotherapy. And we can use the PRP, that is the platelet-rich plasma. We can also use the stem cell therapy for the regeneration of the cartilage in case of the advanced stage of the osteoarthritis. Okay. And later on, I will tell something about the osteoarthritis, not in this class. Later on, whenever the osteoarthritis will come for the knee joint, I will tell something about the approaches of the osteoarthritis treatment for in the physical medicine arena. And prolotherapy, just before I told you about the prolotherapy. And another thing is the spasticity. You know, the spastic patient will be there. And these are not, if the spasticity is not well treated after the stroke, and if the patient is a neglected patient by the surrounding people, so that then the patient will be having this kind of spasticity. Mind it, I'm showing my own attitude of hand. You see, the patient will be having this kind of spasticity like this. Sometimes if you go out, sometimes you will get some of the beggars coming in front of you asking for the alms. Okay, bhikka chaite ashe, showing their spastic hand. And these are the consequences of the neglected form of the spasticity. Okay, and it happens due to the stroke, and due to the non-continuation of the physiotherapy, the patient developed this kind of spasticity. So that is actually so much agonious thing for the patient. The patient can't utilize the hand, the patient can't go for taking anything with their own activities. So that time, whenever this kind of patient comes to the physiatrist, actually the physiatrist may go for the spasticity treatment with the support of the phenol or the botulinum toxin injection, or sometimes we may use the intrathecal baclofen pump. Actually, this is under the trial. We are not actually utilizing these things, but in the developed country, they are utilizing. But here in Bangladesh, even in Chittagong, we are utilizing the phenol or botulinum toxin injection. And there is one center that is a physical medicine center in Chittagong. And we are utilizing this phenol and botulinum injection with the support of the ENT guidance. Okay. And the nerve and the muscle biopsy can also be taken out by the physiatrist, but this is not well not well supported by the physiatrist, and we are not that much practicing that much here. Okay. And another thing is that for the treatment of the patient of the physical medicine, we also use the physiotherapy and occupational therapy. I will tell something about this. And we also take the prosthetics and the orthotics to go for the early mobilization and to go for the total activities of the fitness condition of the patient. Okay. And sometimes we also use the complementary alternative medicine in the form of the acupuncture or acupressure. We also sometimes use the complementary support for reducing down the pain. And sometimes we also use the cupping therapy in the physical medicine. These days we are also practicing these things, and it is also called hijama therapy. Okay, so that is also well practiced in the Western countries. Even if you go to the Mongolian countries, like the China or the Japan, they are also using this kind of cupping therapy. And the physiatrist must actually go for the assessment of the disability and impairment. By going for the assessment, actually the physiatrist can make a structure of the total rehabilitation procedure for the disabled person. And according to that structured information, the physiotherapist and the occupational therapist actually will implement the physiotherapy and occupational therapy to the patient. Okay. So here I'm showing some of the assistants to the physiatrist. There are 4 assistants to us, that is the physiotherapist, very important thing for us. Another one is the occupational therapist. In short term, it is called as OT and PT. And another person, those who are having, those who help us in the speech therapy, those who are having the speech problem in the dysarthria or the global aphasia. So that time the speech therapy therapist will help us. Another one is the orthotist and the prosthetist. This orthotist and the prosthetist actually will help us to go for the early mobilization, to go for the total rehabilitation procedure of the disabled person. So now, what the physiotherapist will give the help for the total rehab procedure of the disabled person. Okay, the physiotherapist will treat the physical injury and dysfunction, usually by the support of the exercise and the physical agents. And the physical agents, actually, there are lots of physical agents in the form of the heat, in the form of the electrical stimulation, in the form of the cold. So these physical agents are utilized by the physiotherapist to reduce down the pain, to go for the early mobilization of the patient. And the physiotherapists are called as physio. You know, the team physios are there in our cricket team, in our Bangladesh football team. So these physios are also the physiotherapists. Okay. So they help in to restore, maintain, and make the most of the patient's mobility minded. And they also help through the physical rehabilitation, injury prevention, and the health and fitness. Actually, these are the activities of the physios, and they actually help the players in their playing activities to prevent this kind of injury, to go for the treatment of the early recovery from the injured condition during the playing activities. So these are very important things. And there are some of the types of the physiotherapy. You know, for if you think of the types of the physiotherapy, there are geriatric physiotherapy, there are sports physiotherapy, orthopedic physiotherapy, pediatric physiotherapy is there, and the neuro physiotherapy is there, respiratory physiotherapy is there, and cardiac physiotherapy is there. So all these kinds of subspecialties of the physiotherapy, actually, they are also very much helpful for the regaining the total optimal potential activities to his early occupational areas. So that is very important things. So now the equipments used in physiotherapy. So what are the equipments can be utilized by the physiotherapist to go for reducing down the pain, to go for the early mobilization of the patient? First of all, the anatomical chart and books that must be there to go for the early intervention of these conditions, and the anatomical model must be there so that he can identify the disease condition very easily. And the electrotherapy and the physical agents. I will show some of the pictures of the electrotherapy and the physical agents to reduce down the pain, to go for the early motion of the patient. And exercise ball. You know, the exercise balls are there. I will show some of the pictures later on. And exercise equipments in the form of the treadmill or the static cycle or the suspensory binders for the patient, and the general exercise. And in the form of the therapeutic exercise or the fit exercise, and the hand therapy. I will show some of the things later on. And other things that can be utilized by the physiotherapy, that is in the form of the hot and cold therapy, and the lumbar rolls and the sitting wedges to maintain the proper ergonomical condition of the back. That is, the back support must be there to maintain the total curvature of the spine. And the massage products. Okay, there are lots of massage products like whatever is utilized for the spa therapy. And the orthopedic supports. There are lots of orthopedic supports in the form of the orthosis, like the tennis elbow strap, like the ankle foot orthosis. Lots of things are there. And the orthotics and the foot care. I will show some of the orthotics and foot care later on. And the pain relief balm. You know, the pain relief balm. These are also utilized for reducing down the pain by the physiotherapist to go for the massage or manipulation therapy. And sometimes the physiotherapist utilize the yoga procedure for the rehab protocol of the disabled person. So you see, there are some of the pictures of the physiotherapist. The patient is being supported by the physiotherapist to go for the early mobilization, to go for the activities of the impaired limbs. So you see, here the physiotherapists are supporting the patient for maintaining the balance, to go for the walking activities by utilizing the walker, by utilizing the parallel bar. Okay, and the exercise is being instructed by the patient. So all these things are being supported by the physiotherapist. Okay, so you see, there are some other exercise. You see, the lady is running on the treadmill, and here the patient is utilizing the static cycle. So all these things are very helpful to go for the early motion of the patient. The same thing, just before I told you about these things. Okay, the same thing. So now, what are the physical agents that can be utilized by the physiotherapist in the form of the light, in the form of the heat, in the form of the cold and electricity, or the magnetism? Sometimes magnetism can also be utilized by the physiotherapist to reduce down the pain. Okay, and the exercise and massages and the manipulation. And chiropractic practice can also be done by the physiotherapist. So they are called as chiropractor. Okay, so that time they will be called as manual therapist. These are very helpful to reduce down the pain in case of the spinal mobilization. This is very good practice for the manual therapist. And the physiotherapist will apply the physiotherapy to the patient according to the physiatrist opinion. Without taking the support opinion from the physiatrist, the physiotherapist shouldn't handle the patient anymore. So now what's about the occupational therapy? Occupational therapy helps a patient to return to his fullest possible physical, psychological or social competence in his former occupation or adjusted tuned occupation. Mind it, say a patient due to the stroke is not able to do the activities very well. So that time to regain the total optimal muscle power to maintain his own official activities, actually the occupational therapist will come forward to maintain his instrumental ADL, to maintain his ADL. All these things will be supported by the occupational therapist. I will tell something about the ADLs. Sorry for the interruption. I'm having the dryness of the throat. So what is ADL? ADLs means activities of daily living. So what is the meaning of activities of daily living? The person, say I'm a person, I am doing my activities of daily living. I'm a doctor, I am seeing the patients, I am teaching the students. So that is actually my own activities, my own professional activities. But if you think of the rickshaw puller, or if you think of the day laborer, they are actually lifting very heavy objects on the head. So he is doing his own activities. So that is not the ideal for me. That is not the, that is also the professional activities of his own job. So what are the ideals? Ideals are those activities which are commonly done as a normal person by each individual. Say going for the toileting activities, going for brushing activities, going for grooming activities, going for dressing. So these are the common things. These are commonly done by each individual. Say I'm a doctor, I'm getting up from sleep, I'm going to the toilet for the toileting activities, I'm going for the bathroom for bathing activities. And likewise, a person, those who are doing the day laboring activities, they are also doing the same job. They are also going for the toileting activities. They are also going for the bathing activities. They are also going for the grooming activities. They are also going for the dressing activities. So these basic things are commonly done by each individual as a normal person. So these are the ideals. I think you got the point. Okay. So ideal is not the professional things. Ideals are the common things as a normal person, which are commonly done by each individual. So these are the ideals. So I'm showing some of the things about this. So the basic 6 ideals are there. Okay, I'm just showing over here the bathing activities, the dressing activities, the eating activities, transferring. That is to shift the body from one side to another. Say I am getting into the car, I'm getting into the bus. So these are the transferring activities. So a person is going to the toilet. So that is the toileting activities. So every person, you see, just look at this slide and think of all the individuals, those who are doing the same job in their own activities, in their own day-to-day life activities. So these are the basic things. So these are the ideas. The professional things are not the ideas. I think you got the point. So the things, the difference between the occupational therapy and the physiotherapy. The occupational therapist actually helps the people to live as independently as possible with the support of his own proper activities of the muscle. Mind it. But if you think of the physiotherapist, actually the physiotherapist assists an individual with the pain relief and the restoring motion and the mobility. That is to reduce down the pain, to go for the early mobility. That is the highest activities of the physiotherapist. But the occupational therapist, actually, he will try to restore the total professional activity of a patient. So the importance of occupational therapy is much more, and the importance is not less than the physiotherapist. So I think you got the point. So to regain the total optimal potential of the occupational activities, actually the occupational therapist will support the patient like this. But if you think of the pain reduction, if you think of the restoration of the motion, if you think of the early mobility, the physiotherapist will support the patient to go for this. And the 8 areas of the occupational, actually, what are the occupational activities can be done by each person. That is the ideal, that just before I told you, activities of daily living. Instrumental activities of daily living. Say a patient is a rickshaw puller, he is utilizing his pedal. So this is the instrumental activities of daily living for his own professional people. And the sleep and rest, and the work, education, playing activities, and the leisure period. This is also included within the occupational activities. And the social participation. You know, the social participation, also one kind of ideal. Without going for the social participation, actually he can maintain his social activities. So examples of occupational therapy. You see, the patient is there. Actually, he is being taught how to catch any object with the support of the fork, with the support of the snippers. So he is being taught for the occupational activities. So you see another example is there. So another example is there to go for the gripping activities. So these are the examples of the occupational therapy. So you see the kid is being taught actually to insert the thing inside the holes. So this is also one kind of occupational therapy to maintain the preciseness of the hand movement. Okay, precision can be developed by giving this kind of instruction for the occupational therapy. You see, this is the speech therapy. The speech therapist is actually holding one symbol in front of the patient, and she's or he is actually teaching the patient how to pronounce any alphabet like this. Okay, so you see how to produce any sound, and the kid is seeing herself actually into the mirror, and the occupational the speech therapist is teaching her how to utter any sound by holding the mouth. Okay, another example of the speech therapy. And now the orthosis or the orthotic devices and the braces. What are the orthosis? What are the orthotic devices or the braces? These things actually support the weakened muscles while walking. Mind it, the person is having the problem due to any kind of pain or due to any kind of fracture. So that time the orthosis will support the weakened part of the muscle, weakened part of the body. So by utilizing this kind of orthosis or orthotic devices or braces, all the terms can be utilized for the same meaning, can be helpful to go for the walking activities. Okay, and that will also enhance comfort and help to slow the progress of the contracture. You see, a patient is having the weakness, the patient is having the spasticity, and if we are not using the device in the counter direction, the patient will be having the contracture gradually. So you must have to utilize one anti-contracture support, that is anti-gravitational force will be there to counteract the contracture. So that support also will be helpful to reduce the progression of the contracture. Mind it, and can be worn at any time of the day or night. Okay, so these are the basic things of the orthosis. You see some of the pictures of the orthosis over here. These are the lower limb orthosis. And this is also another picture of lower limb orthosis. This is also another picture of, and this is also another picture of the lower limb orthosis. And what's about the prostheses? Actually, this is another name, could be the artificial limb in case of the limbs. This is utilized for the replacement of the missing body part. Say a patient is having the amputation of the limb, so that time the artificial limb must be there. Okay, that is the vital part of the rehabilitation process following an amputation. Mind it, a patient is having the amputation, so that time he must be rehabilitated by utilizing the prostheses or prostheses. Okay, and that will definitely improve the quality of life. Okay, without having the support from the prostheses, the quality of life can't be maintained by the patient. So you see, I'm moving the cursor. You see, I think in the earlier age of the development of the medical science, this kind of process had been there. I think in the Pirates movies, actually, you saw some of the processes like this. And later on, it came like this, came like this. So these last two are the current processes for the lower limb. For the Paralympic, this kind of two prostheses are used by the Paralympic players, and these are very popular these days. Okay, and these are very much expensive, but still that is very hopeful things that these days actually science has been so much developed, and by using the bionic support from the brain, by using the chip support from the brain, actually this can be actually active. You see another hand prosthesis, that is the bionic hand, and the left hand is also very much active, and for the stepping the left hand is also being used, and that is the prosthesis for the upper limb. So now I'm taking some more times from you. Okay, so the PMR treatment, what are the PMR treatment? What kind of treatment can be provided to the patient? First of all, for the treatment of the pain. That's why the PMR physician are also called as the pain physician. Okay, and the paralysis. If you think of the paralysis due to the stroke, due to the paraparesis, due to the spinal cord injury, due to the entropion neuropathy, the physical medicine and rehabilitation will be supportive so much for this case. The arthritis. Earlier, I told you about the rheumatoid arthritis or ankylosing spondylitis or any kind of geriatric arthritis, like in the form of the osteoarthritis. This kind of arthritis can be supported by the physiatrist or in the physical medicines area. And the sports injury, a sports injury could be in the form of the overuse syndrome, could be in the form of any kind of ligament injury or the tendon injury. So can be supported by the physiatrist. And the soft tissue rheumatism. Earlier, I told you about the soft tissue rheumatism. I think I didn't tell you that is the tennis elbow, or in the form of the bursitis, in the form of the subacromial bursitis, in the form of the subacromial tendinitis, or lots of things are there in the form of the soft tissue rheumatism. That is the any kind of painful condition in the soft tissues is called the soft tissue rheumatism. And the rehab protocol, that is the prime thing of the physical medicine. So the diseases in the arena of the physical medicine, you see the diseases, that is the degenerative diseases, the rheumatological diseases, or soft tissue rheumatism, the sports injury, and the overuse syndrome. All these things just before I told you, but again I'm telling for this slide the neurological problems, the rehab of the orthopedic and the rheumatological, neurological, cardiac, and respiratory disorders. So these kind of rehabilitation protocols must be established by the physiatrist. Okay. So what's about the inclusion of the PMR rehab? Okay, that is first of all comes the orthopedic rehabilitation, rheumatological rehabilitation, those who are having the arthritic condition along with the disability, along with the deformity of the hand, like the swan neck deformity. The rehabilitation protocol must be established for the rheumatological problems, and that will be also supported by the physical medicine. And the neuro rehab for the stroke, for the myopathy, for the myasthenia gravis. So this kind of neuro rehab must be supported by the physical medicine. And the cardiac rehab, after undergoing the cardiac surgery, the patient must undergo the cardiac rehabilitation protocol. Otherwise, the patient won't have the total cardiac activities as before, mind it. And the respiratory rehab, the same thing. After having the lobectomy of the lung, the patient must undergo the respiratory rehab. And the sports rehabilitation. The patient is having the repetitive injury in the tennis elbow, so you must have to give the support to the patient for the sports rehabilitation. So I'm not telling these things for you. That is the rheumatism disorders that can be undergoing for the rehabilitation protocols. So what are the treatment can be provided by the physical medicine other than the drugs to control, to reduce down the pain, to maintain the mobility of the patient? First of all, here we use some of the physical agents, that is the hot modalities, that is the heat modalities, wax bath, short-wave therapy, TENS, ultrasound therapy, microwave therapy. Among these, short-wave therapy, ultrasound therapy, and microwave therapy, these are the deep heat modalities. And the wax bath and the TENS. Wax bath, this is the superficial heat modality, and another one is the TENS. This TENS actually will be helpful to reduce down the pain. And another one is the harbor tank, whirlpool bath, hot water swimming pool, contour bath. Kamrul, I'm taking some more time, only 5 minutes. Okay, within 5 minutes I'm finishing right now. So these things. Okay, thank you. So another one is to prevent the deformity. The patient is having the problem, so sometimes due to the rheumatological problems, the patient might be having some kind of কামরুল তোমাকে তুমি মিউট করে দাও, mute yourself, mute yourself. There are some causes. Okay, thank you. To prevent the deformity, we can use the sprains, board, and the roll. Okay, and sometimes to prevent the contracture, actually at least 3 to 5 asymmetric contraction will be supported to reduce down the contracture. These are very important things. Okay, I'm going very fast to take less time from you. And the preservation of the function. To preserve the function of the injured limb, actually, we must have to go for the therapeutic exercise. We must have to maintain the range of motion, endurance, and strength exercise. And to restore the lost function of the area of the injured area, we must have to go for the physiotherapy with the support of the aids and the appliances. Okay. Okay, I'm just going for showing some of the pictures of the physiotherapeutic agents. What are the things that we are using in our department? These are the very primary things. And one thing is that physical agents, those who are being used in our physical medicine, actually these can be used for the cardiac patient, for the renal impaired patient, that is the CKD patient, for the hepatic patient. All this kind of patient can take the support from the physical medicine to reduce down the pain. So if you get some patients having the cardiac problem, having the CKD, advanced stage of CKD, no kinds of drugs can be prescribed to the patient. So that time you can easily prescribe the physiotherapy. Okay. So you see there are some kind of pain control panel, heat modalities. To reduce down the pain, there are two kinds of things. Another one is the heat. Number one is the heat. Another one is the electrical stimulation therapy. And that is the TANS and IFT can also be utilized to reduce down the pain. I will tell something later on, not right now. And Faradic and electrical stimulation. Whenever the patient will be having the partial neuronal problem, that is the partial weakness is there, that time we can use the Faradic stimulation. If the patient is having the total neuronal problem, that is the total weakness is there, that time we must have to use the galvanic stimulation of the electrical stimulation therapy. And we also use the cervical traction and the lumbar traction. Now I am showing some of the pictures. You see, this is the wax bath therapy. This wax bath therapy is utilized to reduce down the stiffness. I am not taking more time from you. That is the infrared radiation. This is also helpful for stimulating the neuronal sprouting in case of the stroke patient. And this is the short wave diathermy. That is one kind of deep heat modality. Okay, and that is also very helpful for the low back pain or the neck pain. And that is the microwave diathermy. This is another method of the deep heat modality. And that is the ultrasound therapy with the laser. And this is also helpful for localized pain in the form of the tennis elbow. That is the transcutaneous electric stimulation. This is also helpful to reduce down the pain. Okay, and that is the lumbar motorized traction. This is used for the sciatica or the anteroneuropathy in the lumbar region. And the cervical motorized traction, and that is the laser. Okay, I'm not telling anything about this adjustable examination treatment bed, and that is not available in our department, but that is very helpful for going for the chiropractic practice. That is the manual therapy is actually must be done within this bed. You see, that is the hydrotherapy that is used for the stiffness or the contracture prevention. I'm not telling about these things. I'm just showing the pictures. That is the Hubbard tank, the picture of the Hubbard tank. Another, that is a whirlpool bath that is used for the stroke rehabilitation. And that is the uncatable exercise. Those who are having the knee pain, for the knee pain, the patient can't go for the weight bearing over the knee joint. So that time the patient will be having the busting of the hamstring and the quadriceps muscle. So that time, to improve the strength of the muscle, this uncatable exercise is very helpful. So that is the parallel bar to go for the relearning and the rebuilding of the walking pattern of the stroke patient. This parallel bar is used. So I think that's all for you. Thanks a lot. Kamrul, I think I should.
Thank you.
ওয়ালাইকুম আসসালাম। আমি মনে হয় আজকে
স্যার একটা কোশ্চেন ছিল।
হ্যাঁ বলো।
স্যার একজন ফিজিয়াট্রিস্ট কি সার্জারি করতে পারবে, যে কোনো ধরনের সার্জারি?
না, আসলে এক্স্যাক্টলি সার্জারি কথা। আচ্ছা, তোমরা মিউট করো, আমি আমার কথাটা বলছি। নয়েজ হচ্ছে, কামরুল নয়েজ হচ্ছে। সার্জারির ব্যাপারে যদি আমরা বলি, আসলে আমরা এটা আসলে আমাদের দেশে আমরা খুব বেশি সাপোর্টেড না এই ব্যাপারে। তবে ডেভেলপ কান্ট্রির মধ্যে বিশেষ করে যাদের ট্রিগার ফিঙ্গার থাকে ওদের ক্ষেত্রে দেখা যায় ডে কেয়ার সার্জারি কিন্তু ফিজিওথেরাপিস্টরা করে, ঠিক আছে। এছাড়া সার্জারি আমরা করি না, তবে ভার্টিব্রোপ্লাস্টি তারপর কাইফোপ্লাস্টির কথা যেগুলো বলা হচ্ছে এগুলো আসলে আমাদের দেশে আমাদের একজন সিনিয়র ভাই আছেন, উনি অ্যাসোসিয়েট প্রফেসর ঢাকা মেডিকেল কলেজে, উনি কিছু কাজ করছেন কাইফোপ্লাস্টি এবং ভার্টিব্রোপ্লাস্টির উপর। আমার কিছু এক্সপোজার আছে তাইওয়ান মেডিকেল ইউনিভার্সিটি থেকে, আমার কিছু এক্সপোজার ছিল, তবে নট দ্যাট মাচ, ঠিক আছে। তবে আমাদের যে ভাই আছেন ঢাকা মেডিকেল কলেজের, উনি অ্যাসোসিয়েট প্রফেসর মনিরুজ্জামান ভাই, উনি এই কাজগুলি কিছুটা করেন পপুলারে, ঠিক আছে। তো এই সার্জিক্যাল ইন্টারভেনশন তোমরা যদি এগুলোকে সার্জারি বলো, দ্যাট কুড বি দ্য ইন দ্য ফর্ম অফ সার্জারি। আর যদি ডে কেয়ার সার্জারির কথা বলো, আমাদের এখানে যে টেনিস ট্রিগার ফিঙ্গারটা হয়, এটা আমরা ডে কেয়ার সার্জারিতে এটা কিন্তু ইজিলি সার্জারি করা যায়। যদি সার্জারির কথা বলো, এর চেয়ে বেশি আসলে পারমিটেড না, as we are not the surgeons, we are the physicians. Any more questions?
স্যার 18 ইয়ারের নিচে যাদের মানে ক্রাইম করতেছে তাদের একটা মানে পানিশমেন্ট না দিয়ে তাদের হচ্ছে রিহ্যাবিলিটেশন সেন্টারে আমরা পাঠাই। তো ওই হিসাবে আমরা রিহ্যাবিলিটেশনের সেন্টারের মধ্যে তাদের কি মানে কি টাইপের রিহ্যাবিলিটেশনটা করি?
আমি বুঝিনি তোমার কোশ্চেনটা, আই ডিডন্ট গেট দ্য পয়েন্ট, আবার বলো প্লিজ।
স্যার 18 ইয়ার নিচে যেসব ক্রাইম যারা ক্রাইম করে এই এজের নিচে তাদের হচ্ছে আমরা রিহ্যাবিলিটেশন সেন্টারে মানে প্রোভাইড করি। ওখানে আমরা কি টাইপের রিহ্যাবিলিটেশন দিই?
আসলে দিস আর দ্য সাইকোলজিক্যাল রিহ্যাবিলিটেশন, এটাও একটা পার্ট, তবে দিস আর নট দ্যাট মাচ প্র্যাকটিসড ইন আওয়ার কান্ট্রিজ। আর এটা হচ্ছে আসলে এই সাইকোলজিক্যাল রিহ্যাবিলিটেশনটা দিস আর ডান বাই দ্য psychologist or the psychotherapist or the psychiatrist, not by the physiotherapist or the physical medicine specialist or the physiatrist. Mind it, এটা ডিফারেন্ট জিনিস। এই রিহ্যাবিলিটেশনটা আরেকটা, এটা হচ্ছে মেন্টাল রিহ্যাবিলিটেশন। উই অনলি ট্রিট দ্য মাস্কুলোস্কেলেটাল রিহ্যাবিলিটেশন or the neurological rehabilitation or the orthopedic rehabilitation. I think you got the point.
Yes sir, thank you.
Thank you. আর কোনো কোশ্চেন আছে কারো?
স্যার ফিজিক্যাল মেডিসিন,
হ্যাঁ বলো।
ফিজিক্যাল মেডিসিন এন্ড ফিজিক্যাল থেরাপির মধ্যে ডিফারেন্সটা কি?
আমি তো কিছুক্ষণ আগে বললাম, ফিজিক্যাল মেডিসিনের ট্রিটমেন্ট মডালিটিস গুলো অনেক আছে। এর মধ্যে একটা হচ্ছে ড্রাগ, একটা হচ্ছে আমরা ইন্টারভেনশনের দিকে যাই, একটা হচ্ছে আমরা মিউট করো কামরুল, ইউ মিউট ইউরসেলফ, তোমার নয়েজ হচ্ছে এটার জন্য। তাহলে দেখো, আমরা ফিজিক্যাল মেডিসিন স্পেশালিস্ট হিসেবে উই টেক দ্য সাপোর্ট ফ্রম দ্য ড্রাগস, উই টেক দ্য সাপোর্ট ফ্রম দ্য ফিজিওথেরাপি, উই টেক দ্য সাপোর্ট ফ্রম দ্য অকুপেশনাল থেরাপি, উই টেক দ্য সাপোর্ট ফ্রম দ্য রিহ্যাবিলিটেশন নার্সেস, উই টেক দ্য সাপোর্ট ফ্রম দ্য ইন্টারভেনশন, that is the blind intervention or the sonological intervention or fluoroscopic intervention. We take the support for the nutraceuticals. All kinds of treatment modalities can be provided by the physical medicine specialist. But if you think of the physical therapy or the physiotherapy, actually that is one kind of treatment modalities of the physical medicine. তার মানে আমি যে এতগুলি ট্রিটমেন্ট মডালিটিস এর কথা বললাম তার মধ্যে একটা হচ্ছে ফিজিক্যাল থেরাপি। তাহলে তুমি যদি কনফাইন করে ফেলো ফিজিক্যাল মেডিসিনকে উইদিন দ্য ফিজিওথেরাপি, দ্যাট উইল বি আ গ্রেট ক্রাইম ফ্রম ইউর সাইড। আমার কথা ক্লিয়ার? তাহলে ফিজিক্যাল থেরাপিটা হচ্ছে জাস্ট এক্সারসাইজ এবং ম্যানুয়াল থেরাপি এবং ফিজিক্যাল এজেন্টস দিয়ে পেশেন্টের ব্যথা এবং তার মোবিলেশনটাকে বাড়ানো, ব্যথা কমানো এবং মোবিলেশনটা বাড়ানো, দ্যাট ইজ দ্য ফিজিক্যাল মেডিসিন, ফিজিক্যাল থেরাপি। আর ফিজিক্যাল মেডিসিন, দ্যাট ইজ আ ভেরি বিগ চ্যাপ্টার। Among all these treatment modalities of physical medicine, another one of them is the physical therapy. তাহলে physical medicine আর physical therapy are not the same thing. Physiotherapists or physiatrists are not the same thing. Physiatrists are the paramedical are the medical personnel with the postgraduate qualification in the physical medicine. Our physical therapists, they are the paramedical personnel, they are not the doctors. Okay, even after having the MBBS degree, actually they are liable under you. If you have the idea to prescribe anything for the treatment, the physiotherapist actually is obliged to follow your instruction, and they can be ordered by you. Did you get the point?
Yes sir.
Okay. আর কোনো কোশ্চেন আছে কারো? কামরুল, do you have any question?
জি স্যার, একটা কোশ্চেন ছিল স্যার, সবচেয়ে সেফ অ্যানেস্থেটিক কোনটা ইউজ করা যায় এই যে পেন রিলিফের ক্ষেত্রে?
ভেরি গুড কোয়েশ্চেন। আমি অ্যানেস্থেটির ব্যাপারে একটা ক্লাস নিব তোমাদের সামনের সম্ভবত নেক্সট ক্লাসে আমি অ্যানেস্থেটির উপর নিব। তো যেটা সেটা হচ্ছে অ্যানেস্থেটির মধ্যে এর মধ্যে আমাদের দুইটা কথা চিন্তা করতে হবে অ্যাকর্ডিং টু দ্য সেফটি। যদি সেফটির কথা চিন্তা করো, আমাদের যদি কিডনি সেফটির কথা চিন্তা করো, তাহলে কিডনি সেফটির জন্য আমরা যেটা সেফটির কথা চিন্তা করি মানে NSAID কিডনি সমস্যা করে, which is a very common known actually idea among the normal people, that among the laymen. So they think of the kidney. সো এই জন্য কিডনির সমস্যার কথা যদি চিন্তা করো, তার মধ্যে সবচেয়ে সেফ NSAID হচ্ছে সুলিনটাক এবং নাবুমেটন। দিস টু NSAIDs, দিস আর দ্য কিডনি স্পেয়ারিং NSAID। তার মানে কিডনি প্রোটেক্টিভ যে প্রোস্টাগ্ল্যান্ডিনটা তৈরি হয়, এটার প্রোডাকশনে কিন্তু এই দুটো NSAID কোনো বাধা দেয় না। কিন্তু অল আদার NSAIDs দে ক্যান ইন্টারাপ্ট ইন দ্য ফর্মেশন অফ দ্য প্রোস্টাগ্ল্যান্ডিনস। তাহলে এই NSAID এর মধ্যে সব NSAID এর কথা যদি চিন্তা করো, যদি ব্যথা কমানোর ওষুধের কথা চিন্তা করো, তাহলে আমরা ব্যথা কমানোর ওষুধের ক্ষেত্রে সবচেয়ে ভালো হচ্ছে আমরা NSAID অ্যাভয়েড করি। বাট ইফ ইউ থিঙ্ক অফ দ্য NSAID, if anybody asks you about the NSAID which can be prescribed even in the kidney disease, for your knowledge, if anybody asks you during the exam, you can tell these two names, that is the sulindac and the nabumeton. These can be utilized for the kidney disease up to the stage 3. এরপর stage 4 এবং 5 এ কিন্তু এই NSAID ও ব্যবহার করা যাবে না। এবং আরেকটা কথা যেটা বলা হয় সেটা হচ্ছে tanoxicam, that can also be used for the kidney disease but better to avoid. But the safer ones are the sulindac and the nabumeton. ক্লিয়ার? আরেকটা কথা হচ্ছে যদি কোনো ধরনের NSAID আমাদের দেওয়ার কোনো প্রফেশন না থাকে, কোনো ধরনের ড্রাগ দেওয়ার যদি কোনো প্রফেশন না থাকে, we have the option for the physical medicine. That is the unique thing of the physical medicine, that is the physical agents. আমরা এই physical agent গুলো ব্যবহার করব, অথবা আমরা ইন্টারভেনশনে যাব সরাসরি। So these are much more supported for the patient. Any more question? কোনো রিটেন কোনো কোশ্চেন আছে তোমাদের কাছে লাইভে?
জি স্যার, মেসেজ কোশ্চেন ছিল স্যার, এগুলি
বলো,
কিছু
শুনছি, বলো।
স্যার ওইটাই স্যার, NSAIDটা কোশ্চেনটা ছিল স্যার।
আচ্ছা আচ্ছা, আমি নেক্সট ক্লাসটা যেটা নেক্সট টপিক কিন্তু আমি ওই ড্রাগস ইন ফিজিক্যাল মেডিসিন, এটা নিয়ে আমি কিন্তু NSAID এর ব্যাপারে অনেক বেশ কিছু কথা বলবো। এন্ড দিস আর ভেরি ইউনিক থিং, এন্ড এটা কিন্তু তোমরা ফার্মাকোলজিতে এই কথাটা পড়ে আসলে, এন্ড ইফ ইউ ক্যান ফলো দিস থিংস, আই থিংক দ্যাট উইল বি মাচ মোর সাপোর্টিভ ফর ইউর ওন ফিউচার জিপি প্র্যাকটিসেস। এটা তোমার জন্য খুব সাপোর্টিভ হবে। আর কোনো কোশ্চেন আছে?
না স্যার, কোনো কোশ্চেন।
Nafisa, do you have any question?
No sir.
আচ্ছা, I think we can conclude the session, okay? আর কামরুল, হ্যাঁ ঠিক আছে। আচ্ছা, পরে আমি কথা বলবো। আমার মনে হয় সময়টা আমার মনে হয় নেক্সট ইয়ারতে আমি 3টা থেকে 4টা যদি নেই, সমস্যা তো নেই?
না স্যার,
ঠিক আছে, আমি তাহলে একটু আর্লি নিয়ে নেবো, আমার কারণ এই সময় মাঝে মাঝে কিন্তু কাজ থেকে যেতে পারে। তাহলে নেক্সট সপ্তাহে আমি 3টা থেকে 4টা এই সময়টাতে একটু সময়টা নিব তোমাদের থেকে।
জি
হ্যাঁ, নেক্সট উইকে আমাদের টপিকটা থাকবে ড্রাগস ইন ফিজিক্যাল মেডিসিন, ভেরি গুড থিং। এবং আমি 5th ইয়ার স্টুডেন্টদেরকে পড়াই এই জিনিসটা, এবং আমি মনে করি ভেরি ইউজফুল থিং ফর ইউর ওন ক্লিনিক্যাল প্র্যাকটিস আফটার বিকামিং দ্য ডক্টরস, ওকে? তাহলে আজকে আমার মনে হয় এতটুকু শেষ করা যায়।
জি স্যার,
থ্যাংক ইউ, এত সুন্দর একটা ক্লাস দেওয়ার জন্য, অনেক ইনফরমেটিভ ছিল।
থ্যাংক ইউ, ধন্যবাদ। ইনশাআল্লাহ সামনের ক্লাসগুলোতে অ্যাটেন্ড করার চেষ্টা করো ইনশাআল্লাহ।
জি স্যার,
থ্যাংক ইউ। আল্লাহ হাফেজ। জি, আল্লাহ হাফেজ।
আসসালামু আলাইকুম।
ওয়া আলাইকুম আসসালাম।
স্যার আসসালামু আলাইকুম।
ওয়া আলাইকুম আসসালাম।